Hello, everyone. My name is Suba Ross, and I am Director of Admissions for Tulane School of Public Health and Tropical Medicine. And today's topic for our Facebook Live event is a scholarship that is available in our Maternal and Child Health program in our Global Community Health and Behavioral Sciences Department. And today's guest is Shokufeh Ramirez. So Shokufeh is an Assistant Director for Tulane's Center of Excellence in Maternal and Child Health. Shokufeh, would you like to tell us a little bit more about yourself?
Sure, thanks for having me. I am a New Orleans native, and I did my undergraduate at NYU in anthropology, and then came back here to do my MPH. I'm actually an alum of this school, class of 1999, in international health. And then I worked in a number of different health departments around the country, primarily as an epidemiologist and program manager. I'm also a part-time doctoral student here at the school in global community health and behavioral sciences.
Excellent career. Well, how did you come to work at Tulane? With all the places you have available for working, how did you wind up at Tulane?
So, as I mentioned, I am a New Orleans native, and so when Hurricane Katrina hit, I was living in Honolulu, working for the health department there, and was really just drawn back to come back to the city. So I came back with my 3-month-old son and husband, and then wanted to work at Tulane. So I've been here for more than 10 years.
Well, Shokufeh, I understand that you actually won an award from President Fitz. It's the Staff Excellence Award for Humanitarian, which means that your work with our students in the school has been exemplary, and you were awarded for that. So congratulations.
Thank you.
You're a great benefit to our staff and our faculty here.
Thank you.
Well, give us more information about the MCH, Maternal Child Health Program.
Sure. So the MPH in Maternal and Child Health here at Tulane is a great opportunity for those who are interested in contributing to the health and well-being of women, infants, children, adolescents, and families, and gaining the skills to be able to do that. So I think a lot of people think about maternal and child health being just mother and baby, but it's really much broader than that. So we emphasize the life course perspective within our program, meaning that we recognize that the health of all of us is shaped by various influences throughout our lifetimes, and those like the lifetimes of our families.
Okay. What types of jobs are available for our graduates?
So it really depends on the specific interests of a student. We work closely with our students to help them identify more clearly their interests, their career path, what skills and competencies they'd like to develop while they're here, and so that they can then be prepared for the kinds of jobs that they want to have. But some examples of some of our recent graduates include developmental screening coordinator at a state department of health, coordinator of a university's community-based research project, health programs coordinator at a community organization, a project officer at an international development firm, health equity coordinator at a state health department. So those are some of our more recent graduates. For those who have graduated longer ago, of course, they have more senior positions, and a few examples of that include the State Maternal and Child Health Director for March of Dimes, Quality Improvement Lead for a Children's Healthcare Network, and manager of a state health department's breastfeeding program.
Those are excellent job positions for public health.
Yes.
Okay, I understand there are some unique aspects to the MCH program.
Right. So, I mean, as you mentioned, I'm the Assistant Director of the Tulane Center of Excellence in Maternal and Child Health, and that is one of the unique aspects of our program. We're one of 13 schools of public health that has such a grant. We're funded by the federal government. So maternal and child health is something that is funded by the federal government for each state. And that is one of the longest funding streams in this country. So at the height of the Depression, it was recognized that we needed to invest in the future and protect our most vulnerable. And so that funding stream became available for the states. And in conjunction with that, or I should say not long after that, it was also recognized that we needed to have workforce to help fill those positions. And so we are one of the schools that benefits from that, and as a result, our students benefit from that. So we have the Center of Excellence, and that helps mentor students, develop skill building opportunities for them, conference funding, and then within our academic program, we offer a structured sequence of courses for our maternal and child health students. So all of our students do take essential issues in maternal and child health, key policies and programs in maternal and child health, the life course perspective, and evidence-based methods in social and behavioral sciences. Additionally, they take 2 courses that build skill sets essential to MCH work, and those include health promotion and health education programs, and monitoring and evaluation in health education and communication programs.
Well, it's a very strong program here in our school. We're very proud of it. So I understand that students graduate and they're actually prepared to enter the workforce with applied skills. So I'm very happy about that. But this little live event is about a scholarship. So can you tell us about the scholarship?
Sure. For the first time, we're offering the Excellence in Maternal and Child Health Scholarship. It will award a partial tuition scholarship of $25,000 over 2 years. And it is open to students who are entering the MPH program in maternal and child health this fall. And they've submitted their full application by March 31st through Shokufeh, and are U.S. citizens or permanent residents. And so anybody who meets those requirements will be considered for this scholarship.
Well, is there anything special an applicant would have to do to be considered?
No, as long as they've completed their application by March 31st and have met the requirements of being in the MCH program starting this fall and being a U.S. citizen or permanent resident, their application will be considered. It will be reviewed by departmental committee, and the committee will be looking at undergraduate work and evidence of commitment to the maternal and child health population.
Would the review committee be able to tell this possibly through their experience and through their personal statement?
Yes. So, the assumption is you're applying to the MCH program, you've made yourself, you've shown us that you are qualified to be in the MCH program. And so within that application, we will be able to identify that the characteristics that we would be looking for within this Excellence in Maternal and Child Health Scholar.
Excellent. So just to reiterate for our audience, there is a deadline, and it is March 31st. So you still have a few more weeks to apply through our centralized application system, which is Shokufeh, an acronym for School of Public Health Application System. You must be a U.S. citizen or a permanent U.S. resident. And one other thing, is there any need to apply for the scholarship, an application to receive that?
No, there's no separate application process. Just apply to be in the MPH program, and your application is complete by March 31st.
So everyone that applies will be considered for this application. So that's wonderful. So Facebook friends, to give you a little bit of stats on what's going on in that department right now. Thus far in this application cycle, we have received 37 applications for this program. And thus far, we have accepted 31 of the 37. And 6 of those have actually told us that they'll definitely be here in fall and enroll with us. So you have about 2 more weeks to join that number and be considered for this scholarship. So good luck. Okay, well, thank you for joining us today. And I'd like to thank our guest, Shokufeh Ramirez.
Thank you.
Thank you for all of your work you do for us. And thank you for being so helpful to all of our students.
Thank you.
Thank you for joining us. Bye-bye.